What's going on, guys? Tony Maritato here again, and I want to talk about the 5 essential salary negotiating strategies that you need to know before you go into that next job interview. So COVID, the pandemic, wiped out tons of employment. Lots of therapists were out on the market, and then of course even before that we had changes to Medicare reimbursement and changes to regulation. We had home health that was upset. So lots and lots of change going on in 2020. Now it's 2021 and we're looking at what are the opportunities moving forward, and especially for new grads, those of you who are just graduating, entering the marketplace. I want to share my 5 essential strategies, tips and tricks, and the main points that I want you to think about when you're walking into that first time job interview. And I'm going to tell you, this tends to skew more toward those of you who are looking for a job in an outpatient private practice. But some of this will carry over into home health and hospital acute care and other settings. So number 1, know the business model that you're trying to get a job with. You know, there are massive, huge differences between a clinic that primarily treats a Medicare beneficiary population versus a clinic that's treating primarily Medicaid, compared to a clinic that's primarily doing workers' comp, compared to personal injury, compared to cash pay, self-pay services. So the budgets are going to be vastly different. The expectations are going to be vastly different. You need to know going in, if this clinic, so for example, we owned a clinic in South Florida. We were 78 to 82% Medicare beneficiaries. You can look in the public record to see exactly what Medicare reimburses. You can look in the public record to see what other publicly traded physical therapy clinics like US Physical Therapy, how they break down their revenue based on income, based on payer, based on expenses. And you can see what a private practice physical therapist should be producing, how much of that total revenue goes to you. I can tell you that if I was running a clinic primarily treating a patient base with Medicaid as their insurance, I'm going to be looking at $50 to $72 average reimbursement for an hour of therapy. If I was doing primarily workers' comp, I'm going to be looking at $150 to $180 average reimbursement per one-on-one session. That's a huge difference. Same overhead, same cost of care delivery, same everything. But if you don't know those numbers, how can you intelligently speak about what your potential income is going to be? Topic number 2, know who your customer is. Your customer is not the patient. The patient is the beneficiary of your services, but that is not your customer. Your customer may be the business owner, the practice owner. Your customer may be the manager who reports to the business owner. The manager in a large organization is going to have vastly different priorities and objectives than a small single operation clinic owner. You know, I own the clinic. I am in the clinic treating. My priorities are very different than when I worked for a hospital and there was a manager and then a manager above that manager and then the manager above that manager, 10 layers deep. So you have to understand your customer is the person who's hiring you. What is important to that person? For some, it might just be they want to hire somebody that's not going to cause problems. They want to hire somebody that's not going to bring baggage into the clinic, that's not going to bring politics and not going to bring family issues and other stuff. For others, they're hiring a money printing machine. You are no different than a financial investment for that hiring person. If you can't produce a return that's worth the risk, they're not going to hire you. If you don't know who the customer is, there's no way to know what that customer is looking for, and if you even want to provide that customer with what they're looking for. So the person making the hiring decision is the customer. Do you want to work for that customer? That's the first question you need to ask. Now, we need to look at item number 3. What does your future hold? It's one thing, and I think we all understand, we'll take a job that pays less, has horrible hours, makes us work like a dog because that is a stepping stone to something better, right? If I'm looking at getting into professional sports and I'm going to come in as an intern and work my tail off and get paid practically nothing, I'll do it for a couple years because then the next step is working for a professional sports team. But I need to know what your goal is. If you don't have a clear picture of where you want to be in 1, 3, 5, 10 years, you're not ever going to get there. You know, Seth Godin is famous for saying, when a plane leaves the airport in LaGuardia, New York, and is flying to Los Angeles, it's off course the entire way. But because it knows where it's going, it makes constant adjustments and lands where it's supposed to land. That is basically the career of a clinician. You don't have to be on course the entire time. You might go left before you go right, but you have to know where you're going, or else you are absolutely wasting time, money, and resources, and you're not going to get there. So think about that. The next item, know what it is that you want. What is important to you? Not just where do you want to be in the future, but what's important to you right now. You know, if you don't have that established, then it's hard for you to know how to pick the environment, how to pick the compensation, the salary. Many times therapists will come into me saying, I've got a spouse, the spouse makes plenty of money, I just want to work, I want flexible hours, I want to start my day after my kids get on the bus, and I want to end my day before my kids get out of school. I want summers off because I want to be able to travel with my family. You know, like, these are the things that are important, and if you don't know what's important to you, some people want money, they don't care about time. Some people want time, they don't care about money. You have to go in with a clear picture of, these are my personal priorities. This is what I value above other things. So when we're negotiating what the compensation, what the package, what everything is going to look like, this is what I cannot compromise. And then finally, something that nobody ever talks about but is absolutely vital. What is your exit strategy for this position? You know, it's not 1959 and you're not going to work for the same employer for the next 40 years. That's just not the economy we live in today. This is a more work on demand, work when you want economy. So I have to go in knowing, hey, what is my exit strategy? Are you going to build this entire operation around me, the employee? And then if I decide that I want to go do something different, everything is going to collapse? Because I don't want the stress of that. Right? So you have to understand, when I leave, what's going to happen. Certainly there are going to be employers out there that are going to turn you into the villain when you leave. Certainly there are going to be employers out there that are going to look at you as a threat, because now you've got this whole caseload that you've built over the last several months, years, that these are patients that are coming to see you specifically. And now you're going to leave. That means those patients are going to want to go with you because they have no ties to the employer. So these are threats to their company, but you have to understand, I'm going to step into this role, but what is my exit strategy? Where do I go when I'm done? You know, and if you can lay that groundwork right in the beginning, right from the start, whether you do it in conjunction with your new employer or you do it in your own mind, I can tell you that it will save both you and the employer boatloads of headache if you know how you're going to exit this position. So guys, those are my 5 recommendations. I don't know if you call them tips or strategies or what you want to call them, but know the business model you're getting into. Know who your customer is at the time of hire. Know what your future holds. Where do you want to go? And is this job going to get you there? Know what's important to you. Is it money? Is it time? Is it benefits? What is important to you? And what is your exit strategy? How are you going to get out of the current situation when the time is right? Guys, I hope this was helpful. I hope especially the new grads out there that are coming out of school, fired up, ready to work, excited to treat patients. I always say, you more than anyone needs to protect your most valuable asset. Your most valuable asset isn't your knowledge. It's not your tools or education or anything. Your most valuable asset is your enthusiasm. And if you pick an employer that violates any of your personal core principles or runs you into the ground just so that they can eke out that profit margin that they need, you are going to be so upset with yourself, because that is going to be time you will never get back. So guys, as always, Give the video a thumbs up if you think this brought value to you. Subscribe to the channel if you haven't, and I'll catch you on the next video. Thanks for watching.